Hello everyone, I am Dr. Ruchira Misra. I am a pediatric hematologist, oncologist and a bone marrow transplant physician. I am currently working at MRR Children's Hospital Thane and at Gleneagles Hospital in Parel. Today we talk about anemia in children. Anemia is one of the most common disorders that we find in children in the pediatric age group. In India, almost about 67% of the children between the age of 6 months to 18 years have been found to be anemic. So what exactly is anemia? We all need hemoglobin, which is a protein in our body, to carry the oxygen to different parts of the body to provide the necessary oxygen to the cells to make them be able to function. And when this hemoglobin level drops, the person develops anemia. So why is it important? Because every cell needs oxygen to function. And if you have an anemia in a child, then obviously the body functions decrease. So how does one recognize that the child is anemic? Most children do not have any symptoms whatsoever. Some of them have very subtle signs like tiredness, refusal to go to play outside, or an inability to play for a long time. Some of them have attention deficits. They want to sit at home for most of their times. Then as things progress, or if the anemia is more severe, they start getting breathless, they start getting growth stunting that starts happening. In some children, they develop abnormal food habits. They start eating chalk or dirt in these cases, which we as doctors term pica. And in some cases, we have worm infestations, and in those patients, you may actually get chronic blood loss, which means that you lose the blood through your stools in these patients. Sometimes because of infections you become anemic, and there's an entity called autoimmune hemolytic anemias or hemolytic anemias in which the blood breaks down, and that is why the person may become anemic in those patients. There are some genetic disorders as well which lead to anemia, and therefore we want to find out the cause for the anemia in children so that we can treat it very quickly. The most common cause for anemia in our children is basically nutritional, and it has been found that based on the maternal hemoglobin, that means if the mother's hemoglobin is low, then the child is also likely to have low hemoglobin levels and become anemic faster. If you have come from a low socioeconomic status, then you tend to be more anemic, and also because of abnormal food habits. So how do you recognize anemia? The easiest way to look at anemia is to look at the skin tone. If you find that the child is looking pale, look at the nail beds, look in the undersurface of the eye, and look at the tongue. These are the commonest areas to see if they are pale, and you should be able to do it. A very simple blood test called a CBC, or a complete blood count, gives you a number to your hemoglobin level, and that tells us whether you are mildly anemic, moderately anemic, or severely anemic and need a blood transfusion as well. So how do we correct anemia? The easiest way to correct anemia is to have dietary changes and have a balanced lifestyle. So if you eat iron-rich foods, and this common iron-rich foods that we know are things that are easily available, fruits like chiku, banana, apples are all rich in iron, dates are rich in iron, you have drumsticks, they are also a very rich source of iron, and then red meats are a very rich source of iron. So if you consume iron-rich food, you are less likely to develop anemia. We have iron fortified foods as well that are available, and iron fortified formulas that are available for small children that can also be taken. But if you want to know more about anemia, especially about genetic anemias, please feel free to reach out to us at MRR Children's Hospital or at Gleneagles Hospital, and we will certainly have a chat with you about your child. Thank you.